Hello and welcome to TSB Talk Sport and Business. I'm Neil Oja. On Talk 100.3, we've been joined by Dr. Umair Qureshi. He's a physician at the DP World's AVIV or the AVIV Clinic. He holds a Bachelor's of Medicine and Bachelor of Surgery, the MBBS degree from University College of London, and specializes in family medicine as well as acute and emergency medicines. He's well known in the region. Dr. Qureshi, welcome to TSB.
Thank you so much, Neil. Thank you for having me.
Dr. Qureshi, first up, when people come to a doctor, and this is a very common thing. People generally don't like coming to doctors. Why is that imagery so poor about doctors? I mean, you're probably the nicest people that I've ever come across.
I think it's probably a bit of a preconception. Everyone associates seeing a doctor means that there's something wrong.
Right.
I think there may be a little bit of a fear of the unknown, or generally the human mind may have a symptom and always assume the worst.
True.
The reality is they're hoping that we're going to give them good news rather than bad news. I think that's part of the issue.
And Google makes it worse, isn't it?
Dr. Google is one of our pet peeves, as we like to call it. I've got this, I've got cancer. I've got that, I've got cancer. Generally speaking, no, it's just a cough and there's nothing to worry about.
Oh my God. No, I can totally imagine, But hey, there is another completely different world of athletes, of performers who go out and perform for our entertainment. We can sit on a comfortable couch, a comfortable chair and watch them play while they are sweating it out and fighting injuries day in and day out. It's a different world versus a common man's problems of cough and cold and fever. And then we say, that's all right, I'll just pop in a Panadol. But those guys have some serious issues and that could be career threatening.
Absolutely. I think athletic performance at its peak is a whole different game to what normal health would be considered, or even normal performance. Put it this way, you cycle to work. If you shave a minute off your time, wow, great.
True.
For these guys, they're not dealing with minutes, they're dealing with seconds or milliseconds. So what you notice generally about athletes, they're working in this small 0.1%. And what they're looking for ultimately is an edge. And what we are trying to do, what we do, is give them that little bit of an edge. So that's why I think athletes, a completely different field of medicine to what we would consider our normal pill-popping medicine.
Now, you mentioned that, you guys help giving that little extra edge, that microsecond, that millisecond of edge. And amongst that is one of the therapies called the Hyperbaric Oxygen Therapy. What is that?
So here at AVIV, basically, what's core to our kind of practice and what separates us from everyone else is this hyperbaric oxygen therapy protocol that we have. So if you break it down, hyper, increased excess, barrier pressure, oxygen therapy. So we're combining high levels of oxygen with high pressure.
Okay.
Now, by the law of physics, Henry's law typically, if you apply pressure to a gas in the presence of a liquid, it increases that absorption into the liquid.
Right.
Liquid we're talking about here is blood. The gas we're talking about is oxygen. So putting you in a high oxygen environment and pressurizing you basically means we get more oxygen into the blood and we're able to get it to target organs quicker. Now, in athletes, two main organs that we're really, really targeting. Number one, as we know, muscles. Generally, most of these guys are doing physical activity. And the other element that we underestimate is the brain, the cognitive element. I mean, footballers, cricketers, whoever it is, as you get older, technically speaking, you're not meant to get better. Your physiology to a degree is declining. However, your experience is improving. So your brain is working more. And we want your brain working at its peak in order to match up with your muscular performance per se.
This is interesting that you mentioned about, putting in more oxygen, diffusing it into the bloodstream. Obviously, yes, it helps in recovery, helps in muscle building. From a cognitive standpoint also, the brain functions better. Every time you want to make that split second decision, it is the brain's functionality to come up with a solution. But when you say all of these, theoretically, yes, it sounds great. But what is the practical approach? So if, say, an athlete comes to you and says, listen, I want to go through this HBOT, how do you tell them? And then the physical aspect of it, the practical aspect of it, how does that follow through?
Yeah, so ultimately the logistic approach, how you do it. So for me, when it comes to sports medicine and what our application is, there's 5 core elements I like to see it. First and foremost is performance. Performance is essentially a longer process. If somebody wants to improve their performance, like we spoke about, from the brain, from the muscles, it requires time. I mean, they say Rome wasn't built in a day.
Very true.
So ultimately, we got to lay down foundations, and we got to get the body's biology working in such a way that it's able to adapt to the changes that we're implementing, and then it can basically keep that infrastructure there to perform. So this is typically a longer process, and for us that typically requires up to 60 sessions. So we're looking at about a 3-month process, whereby we're putting them in this environment, fluctuating the level of oxygen at very high levels back to a normal level. And what we're doing is getting the body to react to these changes and lay down essentially new vessels, what we call angiogenesis, stem cells. So we want to increase the production, the proliferation, repair areas of damage, which will be important with recovery, and I'll get to that. And then improving what we call cell function. And though, as you know, being from a scientific background, the mitochondria are essentially the power cells of your body. If we can get these guys working better, more efficiently, ultimately getting better output for less input to a degree, you're going to be more of a better machine.
True.
And that's the core principle behind performance, whether that's in the muscle and whether that's in the brain. Then I wanted to touch on very briefly, you got recovery you touched on. Absolutely. These guys, athletes, even us guys, if we've not trained for a while, you're putting your body through high levels of strain.
Right.
And that is a biochemical process. And if we can ultimately reduce inflammation, enhance oxygen delivery, and improve recovery in that way, the results speak for themselves, and people are able to get back to their peak better. And that leads on to less risk of injury. Less injuries means
better performance, longer performance.
Absolutely.
Now, very interestingly, you mentioned about recovery. You know, there are various methods that athletes undergo. Some of them go for massages. Some of them, you know, now the modern trend is the ice baths. Back in the days, they would just hop in under a hot shower and feel that the nice soothing hot water run through. But medical science has proven that ice baths are proven to be a better recovery agent as compared to hot showers. But amongst all of these, when you pump in more oxygen, even the basic of science tells you that yes, the recovery would be faster. But is it now a popular means and has been communicated enough to the athletes that, listen, this is the way to probably go through for your future?
I mean, it's a difficult question, and I'll tell you why. Science is never ever one solution.
Right.
We have research for years, and every method has its own merits.
True.
As it does have its own advantages and disadvantages. For us, I feel like we are probably a piece of this jigsaw that's ultimately creating the perfect scenario to help improve performance and recovery in the ultimate athlete. What I can say is there are limitations, as there are with anything, but equally the science and the research that we have supports what we are doing, and we say the proof is in the pudding, but ultimately we have examples within our clinic and even on a global stage. And the examples I like to use are probably two of the biggest athletes that I really enjoy. Novak Djokovic, Cristiano Ronaldo. These guys are known users of hyperbaric oxygen therapy. And it's no surprise that at the age of 37, 38, they're still performing at probably the highest level.
True.
Whereas you go back 20 years, this was probably unheard of.
Which is so true, you know, I mean, and these, both the sports that you mentioned, they demand a lot from an athlete as compared to some of the other sports. Like, I mean, if you were to talk about a billiards or a snooker player probably playing at 37, 38, you would expect him to play for another 5 years. But definitely for a footballer or a tennis player to play at that age and to give that optimum output is just, you know, I mean, a desirable factor for any athlete who's starting off at any age. Now, what is the timelines for this? Like, if I come in, how soon can I expect results, or how soon can I expect myself to get at the optimum level, as one would expect? Because we human beings always think quick.
I mean, everybody wants a quick solution.
There you go.
What I would say is that unfortunately, it's not one fits all. And I don't think ever we should have this approach.
Brilliant.
I think medicine itself needs to be catered. Medicine itself needs to be, one of my favorite words, bespoke or tailored. So what might work for you might not work for me. So this is what we are trained at doing: evaluating, assessing, examining. We have, technology has come so far, and not only outside medicine, but in medicine. So we use the tools that are at our disposal, whether it's imaging in the form of a high resolution MRI, whether we need ultrasonography, laboratory testing, VO2 max testing, exercise testing. So we have a team that is equipped with physical therapy, physiotherapy, manual therapists, a radiologist in-house, an MRI scan, physicians. So what we've ultimately done is built the team to be able to assess each individual and give us a realistic timeline of whatever the indication may be. If you've come in and you sprained your ankle, in theory, outside normal recovery, 2 to 3 weeks.
Right.
For us, if we assess it, MRI it, have a look at what the injury, have a look at the muscle testing functionality, we might be able to get that down to a week. We might be able to get it down to 10 days. Again, it might not be much for me and you, but for a player who needs to play the semi-final of the Champions League, it can be massive.
Which is interesting, because the timelines that you mentioned, normal medicine would always give you those extended timelines that, all right, probably a little tear or a pull, from anywhere from 4 weeks to 3 months, you're off the table. But if there is an acceleration process that is put into play and which is again scientifically proven, I think, we were talking not just from a get back to your game perspective, but from prolonging your entire life cycle as a sports athlete.
Absolutely. And that, I think, is a core principle that, again, we spoke about. Why is elite level athletes different? Because for me, I don't mind if I don't play for 4 weeks. These guys play for 4 weeks out of a 6-month season.
True.
That's 1/6, and that's significant.
It is. No, this is interesting. Now, is there a way that, not just the athlete, but a common man like probably you and I could try out how this is and probably try and get on the better side of life with HBOT?
Absolutely. Look, the applications of hyperbaric oxygen therapy have been long known. We've been using it in traditional medicine for years, and typically examples that I can use would be wound healing, for example, in diabetics, who, when you break it down, have got a reduction in the amount of oxygen and blood flow to the organ. So if we're applying that principle to any organ, it's the same concept. So what we actually work a lot with is brain performance and cognitive performance. You don't need to be an athlete. You could be a high-performing executive who's noticed with time there's been a slight decline in how quickly they're able to do something or how much they're able to remember. Now, you want to get to the point where even as you grow older, you're able to maintain that same degree of functionality. So if we can ultimately improve the recovery of your brain or improve its function using these same principles, then it's only a benefit.
I quite like the idea of becoming limitless from the functionality of using science. But thank you so much for your time, Dr. Qureshi, for joining us today, coming in from DP World AVIV Clinic. We're talking about HBOT, and I'm so sure that this is just the first step towards something really path-breaking that's already available for not just the athletes but common people like you and I. You're not common anymore now that you've been talking about so much science. But hey, you know what? It is available at DP World's AVIV Clinic.
Excellent. Thank you so much, Neil.
Thank you so much.